eye on RSV season. As the respiratory virus continues to linger later than usual, the vaccine window for infants and toddlers is being extended an extra month. Now, this map is from the Association of Immunization Managers, or AIM, and it shows the 48 states highlighted in teal that are extending the RSV vaccine window to the end of April. Illinois is one of those states that's extending that window. But Missouri, as you see there in gray, is not going to extend the guidelines. However, they are allowing case-by-case consideration. So the respiratory virus remains the leading cause of infant hospitalization, and federal data shows positivity rates are significantly higher this time now than it was this time last year. The extension means that providers can keep offering protection for a longer period. Well, heart disease kills one person every 34 seconds in the U.S., according to the CDC, but in many cases, it can be prevented. And several well-known medical organizations have put out new guidelines on how to care for patients at risk of cardiovascular disease. First Alert 4's Claire Kellett explains why these recommendations have been updated for doctors and what it means for patients.
For the first time since 2018, the guidelines on how doctors can help heart patients have been updated. The American Heart Association and the American College of Cardiology, as well as 9 other medical organizations, have some new recommendations for those who have something called dyslipidemia. It's an unhealthy balance of lipids or fats in the bloodstream and a huge risk for cardiovascular diseases.
There's been a lot of new updates in terms of how we treat high cholesterol, new medications, new tests that we can run also. So this is kind of a much needed update.
Dr. Jim Liu with the Ohio State University Wexner Medical Center says the overall frame of the guidelines is still the same. What's different, though, is determining who's likely to develop heart disease or have a cardiac event before either of those things can happen, using a new tool called a prevent calculator.
It's a much more modern risk calculator that incorporates, more modern things, and it's also a more, it looks like a much bigger population.
For those who fall in the new patient category of very high risk, the guidelines suggest early intervention through healthy lifestyle changes, including maintaining a healthy weight, exercising regularly, not smoking, prioritizing quality sleep, and taking cholesterol-lowering medication when recommended by a doctor.